Hi everybody, I'm Dr. Gavin Scriven. People call me Dr. Gav, and with me is the founder of the non-surgical penis augmentation procedure we call Caliber, Dr. Jayson Oates.
Thanks, Dr. Gav, and together we are the Dick Doctors, and we are going to be talking about all things penis. Our area of expertise is injectable penis augmentation. There's a lot to talk about penises, and together, myself and Dr. Gavin will be doing that. Today we're going to be talking about frenuloplasty.
Okay, so a good place to start would be what is a frenulum? Many guys probably wouldn't know exactly what that is.
Okay, well, maybe the first thing I'll do is I'll show you my frenulum. So here it is.
Oh dear.
That's not going to work very well on a podcast, but a frenulum is a band of tissue that tends to restrict the movement of another tissue. So if you've got your tongue and you stick it up underneath your upper lip and you can feel that thin band of tissue there, that's the frenulum of your upper lip. And
Right.
Then there's a frenulum on the penis as well. It's on the underside of the glands, and it's attaching that underside of the glands to the foreskin. So for guys who are uncircumcised, they'll be familiar with the frenulum. For guys who are circumcised, they will be much less familiar with it because often the frenulum is basically excised in the circumcision process.
Right. And what I guess what's the significance of talking about the frenulum today? Why is it so important, and why is it good or why is it bad? Does it cause any issues?
Yeah. Well, of course, the frenulum is a normal part of your penis. It's a normal part of your body, so it's there for a reason, and the reason is there to help pull the foreskin back over the head of the penis to keep the foreskin covering the glands.
Right.
And therefore, when you've been circumcised, well, you don't need it anymore because there's no foreskin to pull back.
That makes sense.
Some guys, it will cause a problem because it can be tight, and that tightness can actually lead to it splitting and tearing. And I know that you've seen guys with this problem just like I have, and apparently it is like just a terrible pain in the head of the penis. It'll often happen while they're having sex, so they've got that tension on the foreskin, and it could be in the middle of having sex, and the frenulum itself splits, and that's that for having sex at that time, and then it can take quite a while to just heal up. And some guys, it'll never really totally heal up, and there's always this little fissure in the frenulum, and are constantly irritated. And then every time they're getting an erection, there's potentially this tight splitting pain, cutting, burning pain underneath the glands of the penis. And the guys get to the point where they're scared of having an erection, which must be terrible.
Yeah, no, it's definitely not a good thing. So we mentioned at the start of frenuloplasty, which would mean somehow,
operating on the frenulum
and getting rid of this problem. Which is what we offer. I know I'm sort of just creating a bit of a question and answer session here, but
pretending you don't know what it is.
That's right.
And so so what we need to do is then release that tension in the frenulum and get it to heal across. And for the most part, it's a relatively thin band of skin, and just under local anesthetic, we can divide it down, put in a few dissolving stitches, and to get it to heal so that that tightness is released, the underside of the foreskin becomes more mobile, and they don't have to worry while erect that it's going to be tight and split. So as you know, it's relatively quick procedure. Little dot of local anesthetic. We've got a special machine where we can divide it through and minimize any bleeding. There's multiple ways of doing it. Different doctors and surgeons have different preferences. Some people like avoiding stitches altogether, and just putting on a bit of tissue glue. I guess it's like super glue, really, because that's what it is, medical version of super glue. And then keeping it lubricated, usually with like an antibiotic type ointment or sort of Vaseline. We get the guys to gently retract the foreskin sort of morning and night, because what you don't want to do in the healing process is it to heal and the two sides to stick back together. And that's probably the main sort of thing that we were trying to avoid and get the guys to do in that sort of post-op healing phase.
Sure. And before going down that path, if there are guys out there with this problem, are there other sort of, less invasive solutions?
Yes, there are, and they start off with just putting some of these ointments sort of on the skin just to try and get that little split to heal. But then you can get that immediate sort of healing to happen, but it's still likely to split again. You can inject a steroid into that area, and that takes away some of the inflammation. And with doing that, you might be able to get a little bit of stretch into the ligament, but it's only a relatively small amount. And for the majority of people, it's not really the answer to what they want.
Right.
Do you use any other
methods?
Invasive?
Yeah, just pretty similar to what you're saying with the steroid, but it doesn't have to be the injectable steroid. They can try a sort of a month course of a topical steroid beforehand to the same area, in much the same way reduces the inflammation, but also can thin and help stretch out the skin or the tissue a little bit more, and they might get just enough stretch to take away some of that tightness. But yes, and it does actually work for a few people out there. But if there's a significant tightness that is causing significant tears, generally that's not enough.
Not enough, yeah.
From what I've seen.
I've generally found, like, as a temporizing measure, that can be good. But yeah, most of the guys who get to see me about a tight frenulum and having pain and tears, they're ready for surgery, and the cream just isn't enough for them. And maybe if they're seeing their GP initially about it, that could be an adequate sort of first line sort of treatment. Has had that conservative treatment first, and then when we're offering them more definitive solution, that they've at least had that option of having a conservative treatment.
Yeah, and I guess a lot of guys would be thinking who have this problem, they'd be a little bit scared about having something like any kind of cutting going on down there, worried about the downtime. But as you said, the downtime's not that significant. The healing time's only over a couple of weeks, really.
Well, they're already on downtime anyway.
Exactly.
Met, guys, when we were training in this years ago, and some of these young guys, they were just petrified, and like some of them had never had a sexual experience, and the only reason was that fear of tearing the frenulum. So it becomes a significant issue. And of course, they don't know who to go to. Like typical guys, they don't just go to their GP and say, I've got this problem, and find out that there's a solution for it. So guys, just as a general sort of thing, if you've got anything wrong with your health anywhere, go and see your GP first. You might find that there's a solution that's a lot easier than what you thought it was going to be.
Exactly right.
Now, of course, there is a little blood vessel at the base of the frenulum, and so that's something that we need to be a little bit careful of. Certainly, I've never experienced when doing this any significant bleeding. And we've got that diathermy machine there that we can buzz any little bleeds. But that's obviously one of the things that we need to be careful of. And then deeper again, there is a nerve, a sensory nerve. But I don't think in general we're getting anywhere down near to that sort of level to encounter these sorts of anatomy that we've got to be more worried about.
Yep.
And in general, most guys, it's a fairly simple division and then stitching the skin back together. Occasionally, you can get a guy who's got a really wide frenulum, and they may take a little bit more surgery. And there are procedures like what's called a Z-plasty, where we rotate the skin around. But overall, I've found being very successful with the simpler sort of procedures that's much less involved for the guys.
And I believe it's not very painful after the procedure during recovery.
No. In fact, generally, they're really relieved right from the start because that tension and splitting is gone. I can remember one guy that did it on, and he sort of came back and he said it's like 90% better, but still had a little bit. And in fact, we did put a steroid injection in him, and that did seem to help. So it's not like any surgical or medical procedure. It's not a 100% guarantee fix for everybody.
Yes,
but it's certainly a big step forward for the vast majority of guys.
And if it doesn't release the tension entirely, I guess there are other options. Seeing someone who could perform a full circumcision, for example. There are other options out there.
Yeah, and I find that most guys are quite attached to their foreskin and want to keep it. So you've really got to have a fairly significant ongoing issue to want to go down the full circumcision route. But that's like the final sort of stage and solution for it if they have to get that far.
Sure. All right. Well, I think that really covers off on the frenulum, what it is, and why it may cause an issue and what the potential solutions are. As Dr. Jayson said, if you have a problem, you need to book in and talk to a doctor. And if it's your GP first, that's fine. And then you can come and talk to us, and feel free to book in a consult with us at the Calibre Clinic.
Great. Okay, guys, if you do have any questions about frenuloplasty or anything else, then just post it down below. We look forward to hearing from you. Otherwise, we'll be back again soon with another episode of The Penis Show with the Dick Doctors.
And don't forget, confidence changes everything.